Thank you, Akshay, and thank you, Devendra, for inviting me. I think what I would like to say is I was just speaking to some of my fellows in the back that I learned a lot from your talk. The amount of places which can help you with this with your fellowships. One of the issues here is I was telling him this should have been on the day 1 or day 2. I mean, I think all of you youngsters here, if you like this course, including myself, I think we'll have to write collectively saying that if you accept this course, please do not keep it on a last day when a lot of residents leave back, because many of them have to go back to work. All the people out there who's waiting out there are the ones who are clinicians where they have somebody else to work for. So this has to be on a day 1 or 2. Wonderful course. Thank you for keeping me part of this. So the big question when anybody starts is why do you need to do research and what do we get out of research? We are more and more getting into this kind of a picture where the normal distribution of your disease does not really exist, and normal distribution of how you outcomes also do not exist. So when you have this normal distribution not happening, it's time we look out. Ashwin is here. He helped me to make this 3-step. I asked him 3-step algorithm, what do you really choose when you want to do anything to do with the research? So he said, get your basic right. Research is not about picking up anything you want. Okay, other day I was in some session where I was looking at people who wanted to do some research, and they had papers like half the research or 75% of the research is done. Okay, I want to do something in vernal catarrh. Okay, let me just do PubMed. Okay, this person has done this, so I'll do the same thing. I told them 99% of them will not even reach even a very low impact journals. You have to challenge your limits. If you want to do on a vernal catarrh, you'll have to see what is not being done. And what is not being done, you'll have to go back and pick up those things. And sometimes you may have to go out of your comfort zone. And when you go out of your comfort zone, that's what you do when challenge your limit. And all these things definitely add spice. Like you see a lot of youngsters presenting at Rangacharis, you're presenting at various platforms, winning awards. And that's what is important. Everything you do is trying to change the old ways of work. The old ways will not really open new doors. So this is been my favorite papers. I put this paper many places in this meeting about Ali Trokamani's group, and what he talks about is in the next decade, the new way of medicine is going to be fought on these platforms, genetics, physiological, and what is very interesting here is this behavioral tracking. It means psychometric analysis. Virtually, he just gives you a very broad perspective. It's not dealing with any branch of medicine as such. So what he says is every patient has got a baseline, and these baselines are all your genetics, what you do, how well you take care of yourself. And it's a deviation from your baseline, and then the disease is to be looked at. For example, it could be diabetic retinopathy, it could be cornea, ulcers, everything. So research is today, we are just getting ready to the next level. And we are 100% sure what is today is when in 10 years, we'll have only few people sitting down here and making notes, and half the crowd or 90% of the crowd will be in OPL or cataract. I think the day will come and a lot of people will come here because that will come to your clinics. And this is what he says, this will come to your clinic very shortly. And if you're not ready for it, it's not going to work. So what has been our philosophy? Like each person, when you start doing research, you have to have a very clear philosophy of why you want to do it, whether for money. Money is not going to be there. You're going to lose a lot of money initially. Then once we start getting grants, is a different question. So curiosity leads to question leads to answers leads to when you get an answer, it becomes translation research, and that becomes to your clinics, and that's how it works, and that's how most of the research lab in this world works. So there are different areas of work. I'm not looking at clinical research. Clinical research is there, your good work, your new instruments, your new surgeries. Yesterday we had innovations. A lot of people spoke about the new ways of trying to treat the same conditions. But All this is going to be there, like genetics, predicting markers, biomarkers, fluids. So when you're looking at a space, these are all the space which you can look at. So I again put this slide quite often, as when somebody says it's smooth as butter, a scientist should say at what temperature, and that is the real way of how a scientist should work. One of the prerequisites is you should have a good team. If you don't have one, you build one over time, or if you see that you can't build one, work with somebody who has that team. Like Akshay mentioned in a very nice way, he said that you have to first find out with whom you want to work and which place you want to apply for. So for example, if your interest is not research, don't join an institute where there's only research. And if your interest is surgery, you have to find a place. There's nothing called I'll adjust. There's nothing called adjust, because you'll be an odd man out. Once you're an odd man out, I think it's going to be a disaster. And these people, because you need somebody to ask questions. You need also somebody to answer the questions for you. Unless you don't have a right people, if you don't mingle with the right set of people, it's going to be a disaster, even for us or even for you. So if you have a question, whether it's your resident level or a fellowship, wherever, you need those kind of people. So this is a small video of what we do in our practice. There are ideas every day, but they disappear at the end of the day because you're tired and your day has been busy and you don't contribute anything to science. But what you should do is, if you want to really be a serious researcher, that idea should never leave you. It should be curious. Every single patient is in translation work. And that ideas, and then you start looking at how. And this has been our model. I mean, you can create any models you want. In our model, we always try to bring the clinic and the science together. So our ideas were always a combination of both sides. So what we started doing one is we started mingling with people who are not the same as you are. And we do not discard this. We've been talking about it for a long time, and a lot of new centers now have started biorepositories. That is a good way today. At least I've seen 5 places last year who have started looking at this seriously. Clinics I'm talking about, Dr. Manish, Dr. Aditya Kelkar, and all of them have gone into this, because I'm sure at some point of time you'll all be able to do all this from their own end. And once you get in there, there's a lot of my own residents, fellows in the past who have to spend, at least if they're keen, they have to spend at least 2 weeks training, and there are some of them are here. Some of them who wanted to do imaging, they also spend some time with the imaging experts. And this is how you create new drugs, innovation, biomarkers, and we have come out with a lot of new patents also on this. So how do you translate what you get, all this, from an idea, from a patient care, the model, experiment, everything? It goes step by step. And then there's a simple thing. We were ridiculed a lot that in India everybody has vitamin D, so what is the big deal? So the first thing in any research is you have to be ready to accept a lot of being shunned at, ridiculed, because nobody wants to see your study. If the same study is done in some other fancy institutes outside India, you probably would get a better respect. Then you can either get out of it and be in your comfort zone or keep publishing. We have published probably the largest series of close to 14 papers in good impact journals from IOVS, TVST to everywhere, including BJO, on vitamin D. And then the world starts looking at you. So each disease you have to question, and to question it takes a lot of time. But the pleasure you get when your work is cited, when your work becomes a part of a routine clinical practice, is phenomenal. And when it becomes translational, when somebody says that, okay, well, because of your work, some big company, pharma company internationally comes up and says, well, we believe in your work, now we want to come out with the drug. And that is a true place of sciences. Sometimes you have to question your definition. This was the paper which kick-started my PhD, where we questioned that KC is not an non-inflammatory disease, and we published a big series of cases. And finally, many textbooks and many papers now remove the word non-inflammatory to inflammatory. So in a small way, you're playing a role, and the journey goes on. This is a paper, unfortunately, it did not come to the liking of the judges. It did not get anywhere, but it has got a full paper at ARVO. sometimes your work never gets appreciated in your own center because people think that it's not going to happen. What we did was we questioned how does atropine help in a myope? A simple question. And then we started looking at dopamine in the tears, and dopamine in the tears and correlation with axial length growth in a child and how atropine works has never been done anywhere in the world. So what does it mean? That tomorrow, if somebody takes up that area of interest, dopamine testing, which is quite easy, in the tears could be a biomarker for whether your child will have an axial length increase or it's just stable, because dopamine holds the axial length from increasing. Small things. Then there are responders, non-responders for any drug, and this is again Ashwin's slide he made some time back about if you have a biomarker, and the biomarkers are from tears or from your vitreous or from your aqueous, we can pick up I just put some names here, XYZ. These are all, just imagine some cytokines, and you can find which one of them actually drives to get into this. And this is the future, and not the future now. The present thing is all about giving drugs and multiple drugs, and we just knock it off. But the future is about finding biomarkers and anything, and tears, according to me, in the next 6 or 7 years will be exactly the same way as how we do the blood. A non-invasive simple test, not me, including big companies who make big machines like Alcon, Zeiss, and all those people are all coming out with kits to measure all this because they see a huge potential. It's like Noah Nordisk came out with the glucometer, and then insulin sales doubled. That's exactly what is going to happen in the future. So finally, what we are trying to combine is, if you look at an eye or if you look at any research, it has to be genome based, it has to have a genetic component, it has to be a cell based, because what gene does, the cell follows. It's a master. And finally, ophthalmology is one place where you have a huge bunch of mathematical algorithms for everything. So the flow, velocity, like every machine is filled. Even only if you connect all of them, only then you probably get a true picture. So this is a very ambitious project. It will take a long time. When we call it the big prediction. We want to look at all of them in diseases like keratoconus, diabetic retinopathies, where we need to predict. And hopefully, you need a big data for it. Hopefully, you can always dream. Hopefully, we combine everything and bring it into the clinical picture. And then, this is how a lot of Google-based AI is now looked at. So, to sum up, I've been very fortunate to have fantastic young clinicians who work with me, who come out with the same, who had the same driving force to do something different. Some of them are here, and we have a fantastic team, a bunch of mathematicians, physicists headed by Dr. Abhijit Sinha Roy, who was heading the Department of Cleveland, and close to around 20 odd PhDs who work in the lab, who help me to keep asking questions. So, lack of adequate facilities and lipid implementations is only in your mind. If you take that out of your mind, I think this is a complete domain out there. If you have 2 minutes, I have 2 clinicians here. One is Ashwin, who took up a path of being the clinician PhD. He finishes it this year. He got married. His wife is also here, so he got deviated from his PhD a little bit. So this year, I think he's going to finish. He's one of the few clinician PhDs from the country who joined as a clinician fellow PhD. He and Natasha both. She's also in this process. So if you can just give us 1 minute of this, because it is important. That's why I thought I'll just spend a few minutes with them, because this is a true journey. What I mentioned, and Dr. Pooja and Shruti, both of them are here, and they can also just sing, because she worked on cell biology and she worked on imaging, and Ashwin worked more on the mathematical point of view. So there are 3 people who worked on all the 3 components, what I just mentioned here, so they can just give an insight into it. Just take quickly.
Good morning, everybody. So about 4 years back, I first met Rohit sir at a conference in Hyderabad. And I told him I wanted to do something different, and he said, I have a machine called retinal oximetry, will you come and work on it? And it was a very different kind of an interview that was there. But the journey after that has been extremely interesting, because I got to work on a machine that is probably the only one in the country at this point. There are a few more reports from other places, but this was the only machine. And we have imaged more than 3,000 different patients for more than about 10-15 different diseases. And it feels great to be able to publish the first nominated database of the country, to be doing work that even the leaders all over the world, then they kind of cite your papers and things like that. So, and this was along with a routine PhD. So the last 4 years have been.
So basically, what he's trying to say is, just because you're doing research does not mean that you can't operate. It's a big barrier in the country. A lot of our people, I think many places in the world, it's in India we cannot have 3 years research and 3 years fellowship. That will become it's impossible. So what we have to do is, what we have to inculcate is that you have to somehow see that India should have a different way of doing it, because we are, like, all of you do research, all of you work on different projects, but I think all three of us don't have the luxury of taking 2 days off in a week and writing a paper, including myself. We have to do it on job, like you finish your work, and so if you're not ready to take it up, it just does not work that way. So basically what Ashwin was trying to say is that you can be a clinician, you can be a researcher, you can do your work, and you can still finish everything in 2 or 3 years time. Maybe he was a little late because he was other things to look at, but you can actually 2.5-3 years is what is required. Thank you, Ashwin.
Thank you, sir.